Well, the Arkansas Crisis Center has launched AR Teen Connect, a youth peer-to-peer tech support line meant to help teens struggling with their mental health. Our Lauren Motley shares the impact this support line may have on kids in the region.
Talking transparently about yourself is truly a leap of faith. There's no better way to start than just going into it. I know when I was personally struggling, my biggest obstacle was myself and how I could translate whatever I'm feeling into something that somebody else can understand. And I think AR Teen Connect is going to be that leap of faith.
The Arkansas Crisis Center is now launching AR Teen Connect, a project that's over a year in the making.
In February of 2025, we launched Chat and Text, and in the first 6 weeks, we served more youth than we had in the entirety of 2024. So we immediately thought, we want to find an earlier intervention. We want to find additional programming that we can use to, be there for the youth in our state. We actually went with a program with Euler, kind of a Shark Tank style hackathon, in which we were a nonprofit that were paired with a group of students that pitched a solution to a problem for their generation. And so they really came up with this idea of a peer support text line,
sparking the creation of AR Teen Connect, the first youth peer-to-peer text support line in Arkansas.
We have 25 kids this summer from about 10 schools in the Northwest Arkansas area that did 56 hours of training.
Undergoing training in active listening, mental health first aid, and for some, assist training.
AR Teen Connect is essentially the 50% before we get to the 100% crisis. We're going to have 4 or 5 teens on the line when it's available. We're going to be accepting texts, responding to them as you would a friend, and really just listen. Be a listening ear, providing some advice or different perspectives on how to look at a situation. Mainly just, hey, I'm here for you. If a crisis were to arise, me and the 2 other area directors, we are 988 trained crisis specialists, and we would step in to intervene.
Not only helping teens struggling with their mental health, but also giving the youth an opportunity to support their communities.
They're very eager to find ways in which they can support their community and their peers. They're very good at having the conversation about mental health in ways that some other generations, my own included, have not been.
I hope for the line itself that it's going to give some hope to some kids, teenagers who haven't found the confidence within them to talk to other people about their issues. It'll also benefit the community in the sense that we're creating teenagers and young adults who are literate in mental health and passing that information on to other people.